We will get through this. We will defeat this pandemic. And to a nation waiting for action, let me be the clearest on this point. Help is on the way.
U.S. President Biden laid out his plan to fight the coronavirus pandemic, but warns things will get worse before they get better. Hello, I'm Arnold Neidman, and this is The Heat. More than 412,000 Americans have died from COVID-19, more than those who died during all of World War II. During his first days in office, President Biden signed 10 executive orders to expand testing and vaccine availability, address shortfalls in medical supplies, and get schools and businesses back open. It's an enormous task that includes a $1.9 trillion economic recovery package that must be approved by the U.S. Congress.
I'm convinced the American people are ready as well to spare no effort, no expense to get this done. What could be more important? The more people we vaccinate and the faster we do it, the sooner we can put this pandemic behind us, and the sooner we can build our economy back and build it back better and get back to our lives and to our loved ones.
Well, for more now on the Biden administration's response to the pandemic, let's bring in our panel. Joining us from Los Angeles is Dr. Gary Richwald. He's a communicable and infectious disease expert and the medical director of Curative California Vaccination Project. Also with us from Arizona is Will Humble. He's the executive director of the Arizona Public Health Association. Here in Washington, D.C., Joseph Williams is the senior news editor with U.S. News and World Report. And Dr. Kate Tulenko is the CEO and founder of Corvus Health and joins us via Skype from Virginia. Thanks, everyone, for being with us. Joseph Williams, fighting the COVID pandemic is the #1 priority for President Biden. He has, as I mentioned, signed several executive orders to that effect. This is what he had to say. Let's listen.
Yet for the past year, we couldn't rely on the federal government to act with the urgency and focus and coordination we needed. And we have seen the tragic cost of that failure. Hospitals are out of beds. Businesses are closed for good. Schools are caught in between. And while the vaccines provide so much hope, the rollout has been a dismal failure thus far.
So, Joseph, there we heard of the president saying that the rollout of the vaccine so far has been a dismal failure. How will it change under him?
Well, already you've seen signs. His executive orders include ways to streamline getting the vaccine from its production places to clinics, trying to get people vaccinated. He's already set a goal of having more than 100 million doses in 100 million arms by the end of his first 100 days. He's signed a mask mandate, which is loosely enforced, but he's also instituted the DARPA, the Defense Production Act, that allows him to go to manufacturers to streamline the process and use government muscle to get more vaccines out the door. Not only that, but also to produce syringes, produce the raw materials, produce vials, and get more vials of this vaccine out the door to get it to people rapidly. So that's probably the chief list on the chief item on his list to get the rollout going. But that's going to take some time. It's all about getting it quickly, but we still have to ramp up. As famously was told yesterday, President Biden arrived in office with barely any kind of plan left over from the Trump administration. So a lot of reporting has been that he's had to build something from scratch. These are all elements of building it from scratch. How quickly he can do that and how quickly he can do that on his own remains to be seen.
Gary Richwald, let's look at the situation in another part of the country, in the West. The picture there is not by any means pretty. It's a dismal situation. Los Angeles County reported 764 deaths on Friday. That's the highest single-day tally, although officials there do say that the rate is falling. Dodger Stadium, a famous stadium there in Los Angeles, is now a mass vaccination site, but people are waiting for up to 5 hours to get vaccinated. How can that vaccine rollout be changed so that people get there and more people are seen to?
Well, the single most important issue is to have a plan. And clearly the county and city that run the Dodger Stadium site really have not had the kind of plan, nor have had the time to do the planning, nor the funding, nor the staff to really make this situation hum. I worked for a company, Curative, which ran that site, but for testing, doing millions of tests and having probably the best efficiency that can be said. And that was a startup company. I think, in a sense, what President Biden is saying is we're on, instead of being on the 20-yard line, getting ready to kick that winning field goal, we're deep in enemy territory. We don't have a clear team. The team hasn't been paid. The team doesn't have the practice that it should have had. And this is really all due to our previous President Trump, who, our former president, I should say, who basically dumped this entire problem of distribution, that last mile, that hardest part of the problem, assuming all the other elements are in place, with no plan. And, you know, this is the single, in my 40-plus year career, I have never seen such an irresponsible activity of just throwing this to the cities, the counties, the states, and having, again, a completely chaotic situation.
Gary, now there is a plan. There's a new administration in town. President Biden has taken over. He's made it his #1 priority. Of course, you know, it's going to take some time for this plan to be implemented. What kind of timeline are we looking at here to see this plan roll out and see more people getting vaccinated?
Well, you know, we've done 60,000 vaccines in the past, we've administered in the past just under a month. And what we've learned from that is, number one, there is an enormous demand. We put 1,000 vaccines up yesterday at 4 o'clock. At 5 o'clock, every spot was filled. So I think what's required is there have to be adequate staff. You know, it's sort of the same story. There has to be enough staff, and there has to be entrepreneurial approaches to the delivery of these services. Counties, I was a former director in LA County's Department of Public Health. I can tell you, we do a great job when we have enough time to get things together. In this case, we're really going to be pressing the county to not just do vaccine, but to also look at testing, to improve contact tracing. If you can't get people's test results back in 24 to 48 hours, it's almost a wasted test in terms of disease prevention. And, you know, we have an environment that's really littered with political footballs and mixed messages and restaurants suing the state and all sorts of things that are not part of a singular, direct, patriotic effort to get out of the enemy zone and get into the winning half of the field.
Right. Let me go to Arizona, to Will Humble. Will Humble, I was looking at figures around the country, looking at the situation in different parts of the country, and here's one alarming development, and this is in the state where you are, in Arizona, and it shows that it's one of 2 hotspots in the United States where children getting COVID is on the rise. Hospitalizations for children are on the rise. What's behind this spike? How do you explain this?
Well, I think it's pretty simple. It's that we have such enormous community spread among all populations that children are included in that as well. I mean, we have been, since January 1st, Arizona has been the national hotspot for cases per capita, positivity, deaths. You go down the list, Arizona has been performing the worst of any other state in the entire country. And the accountability in our state rests with our governor. I mean, there's plenty to blame to go around from the previous federal administration, but there are so many decisions that get made by governors, and he's made some pretty poor ones. And he still, I don't think, has recognized the gravity of the situation. So that's, I think, the answer, which is, you know, a lot of kids are getting sick, are being hospitalized, and this is just a reflection of how many infections are out there in the community.
So, Will, give us some idea of the kind of mistakes that the governor has made, as you say, and what needs to be done right now.
Yeah, well, if we just to focus on the vaccine part of it, well, let me go back and just talk for the community spread part of it. It's our bars, restaurants, and nightclubs are completely open. There's mitigation measures on paper, but none of them are being enforced. These closed indoor environments that really amplify the virus have been open with him just completely since September, unimpeded, without enforcement. That's, I think, the biggest mistake. In terms of the vaccine, Arizona has received from the federal government 880,000 doses of vaccine, and less than 40% of those have actually gotten into arms in the last month. So there's so many vaccines that are still in freezers in Arizona, and it goes to planning and execution, like we were just talking about, at the local and state level. I'll just give you one example of one of the hiccups, which is the state health department here put together, they had a contractor build a website whereby people could go and register and get appointments to get their vaccines, but the website is a train wreck. I mean, seniors can't navigate it at all. They have to get their grandchildren to make the appointment for them. It's not intuitive, and it's caused a lot of frustration among seniors because the system is set, the appointment system has been so cumbersome and ineffective.
Kate Tulenko, the one big change that we will see under President Biden is that this will now be a federal response. It's not going to be left up to individual states. They will have a role, of course, but it will be a federal response. Biden has been facing some criticism for his plan to administer up to 100 million doses of vaccine in the first 100 days. But the country is averaging that right now, about 950,000 a day. So is this new administration on target to meet that goal?
I think they probably are on target to meet that goal, and I think we need to reserve judgment for a couple of weeks because we have to remember that there was a historic lack of transition from the Trump administration to the Biden administration. And in fact, there was also misinformation. For example, in early January, when the Trump administration said that there were more vaccine doses in the reserve, in fact, there were not. So we have to remember that the Biden administration has just been in place for 2.5 days, and they're still trying to figure out the lay of the land and find out exactly what the status of things is. So I think in about 2 or 3 weeks, we'll know a little bit better how the new federal effort is going and what needs to be improved, and if we need to readjust those goals, to readjust them. But we need to remember that this is a new administration with a new, highly politicized vaccine, and they need to build trust with people with vaccine hesitancy. So this is not a time to overpromise.
Kate, one other thing, and Will Humble brought this up a moment ago, is where states have the vaccine, but not the means to get it into the arms of people. What have you heard about that?
Yeah, so that's sort of the lack of the sites, the lack of the people to do the injections, perhaps the lack of funding. And so what the Biden administration has planned is using the National Guard and using existing resources such as school nurses in schools, firehouses to roll the vaccine out faster, because it's really faster when you use existing resources than trying to stand up new resources. And I do think that the solutions they have proposed are quite reasonable and are achievable. I think that really right now the limitation will end up being more how much vaccine Pfizer, Moderna, and Johnson & Johnson can produce rather than the ability to vaccinate people.
Right. Joseph Williams, the one man who is now front and center in this new administration's fight against coronavirus is Dr. Anthony Fauci. He is the country's foremost infectious diseases expert. He has been talking about how to get the country vaccinated. Let's listen to what he had to say.
If we get 70 to 85% of the country vaccinated, let's say by the end of the summer, middle of the summer, I believe by the time we get to the fall, we will be approaching a degree of normality. It's not going to be perfectly normal, but one that I think will take a lot of pressure off the American public.
So, Joseph, we may have the vaccines, we may get it out there, we may be able to distribute it, but there is another problem. There are quite a number of people in the country who do not want the vaccine, and that's especially true among parts of the African-American community, parts of the Hispanic community as well. It's just because they do not trust the government. I mean, how big a challenge is this? How does one overcome it?
It's a huge challenge, and it's got a lot of facets to it. One of the facets that immediately come to mind is the fact that Donald Trump was promising this vaccine in warp speed as he was still running for re-election, and that caught a lot of people the wrong way. People suspected that it was a ploy. People suspected that it was something that he cut corners on safety just to get out of the door, just so he could win an election. With Donald Trump out of the way, it is it is a huge obstacle that's been removed from the field. Certainly, Dr. Fauci thinks so, because he's been talking over the last couple of days about how he feels liberated to talk about science and let the science speak for itself. And he's going to have to do a lot of that to convince people who are hesitant to take the vaccine. The more you see of Fauci, the more you see of him on television giving unfettered advice, I think will go a long way towards convincing people who are vaccine shy right now to try to go ahead and take the plunge. But that being said, it is still a difficult challenge, because there are so many people in minority and underserved communities who don't trust the government for various reasons and don't trust the medical system, in fact, because of discrimination that's still going on, much less discrimination and heinous kind of activity that happened in the past. Specifically, we're talking about the fact that a lot of communities don't have healthcare centers that are very close or that are very effective or that are even on the list to receive vaccines. So that's got to happen. Another session that's got to happen is influencers have to be out in front convincing people that this vaccine is safe, telling them that they're getting it themselves in their own arms, and letting them know that it is safe and that it is urgent imperative for their communities to get this done, because theirs are the ones that are most hurt. But also you have to have a sweeping kind of public relations campaign, everything from barbershop vaccination centers to public ads, to public service ads on radio, TV, on buses, to get the word out that this is important. In order to get a handle, and in order for life to get back to normal, we have to get this done.
Kate, you know, a moment ago you were talking about the Johnson & Johnson vaccine. That company, it's a pharmaceutical giant, of course, it plans on producing something like 100 million vaccine doses by the spring. It's still holding clinical trials. Is this the single-dose vaccine? And if they manage to produce it, how much of a game changer will that be?
Well, it does have the potential to be a game changer for a number of reasons. One, it's a single dose, so that means it's faster and easier logistically to give it, and you don't have any loss to follow up that you might have with the other ones where someone gets one dose and not the second dose. But also, it's a different type of vaccine. Whereas the Moderna and Pfizer vaccines are mRNA vaccines, this is a live attenuated adenovirus. So it's a live virus that when injected, it goes into the cells and basically imitates an infection with COVID. And it can be stored at more normal temperatures than the Pfizer temperature. Now, currently, J&J is running a third phase clinical trial with 45,000 patients, and they think they'll be able to release the data at the end of January, and they're looking at emergency use authorization in March. Now, we've already had 2 vaccines approved, so people know the type of data and the weight of data that you need to get this emergency use authorization. So I think J&J can be pretty confident that their data will be strong enough to get the authorization. And if they are able to produce 100 million vaccinations in the next few months, that really is enough probably to vaccinate all the Americans who are currently interested in receiving the vaccine.
Gary, getting back to California, there are reports that the COVID surge has actually passed its peak in the state. In fact, there are reports that the surge has passed its peak across the entire country. But there's still a high number of fatalities, as we mentioned earlier, in California. What is your assessment of the situation across the state?
Well, our number one intervention at this point is, in fact, vaccination. If vaccination is unsuccessful on getting the rates down on a sustained basis, then we're in serious trouble. And I don't think that I'm looking forward to the honesty policy that's going to come out of Washington. But I think we all have to remember, in a sense, this is our 11th hour intervention. And if this doesn't work, we're going to have much more dire interventions. There's going to be pushback associated with this. We've already seen that. But I think the number one thing for people to remember is, once you've had your vaccine, you still need to observe social distancing, masking, hand washing, etc. The purpose of the vaccine at this point is to get the rate of transmission down. So the children in Arizona are not living in the apartments where their parents are frontline workers in grocery stores, transportation, etc., and infecting them. If we cannot get this vaccination situation working, we're in serious trouble. You know, at Curative, I just want to say, this is all in hand. We have kiosks for areas which are less populated. We have mobile vans for all of our nursing homes. We've done 60, 70 nursing homes already. And we have drive-throughs where people are literally injected in their vehicles and then observed. And so there are entrepreneurial approaches to doing this. And I think in many areas, municipalities have embraced this. But unless we work at the local level and quickly, and really, I got my shot on Monday, and because our nurses, our 100 nurses that we've hired, they were first in line. Unless we start talking about that this is our last play, the vaccine play, the last major play, you know, we're not being honest with people.
Well, Humble, you know, you were talking about two of the big problems in Arizona. One is that there are vaccines in the state, but it's been a problem getting them into the arms of people. The other was that, especially for older people, they have difficulty navigating sites, finding places where they can be vaccinated, etc. Is the federal program going to be able to change that in any way?
Good question.
Well, I certainly hope so. You know, one of the things that I was really pleased to see with the Biden administration's plan is that they had a clear lens and focus on health equity and making sure that their plans they're going to force states and locals and maybe even the FEMA clinics themselves to focus on those underserved and underprivileged privileged communities.
Right.
You know, one of the things about the vaccine rollout in Arizona is that I got to tell you, it is focusing on upper middle class folks. You know, in order to navigate the system that we have, you've got to have, you know, you've got to be adept at your computer. You need a new browser. You got to have the ability to sit in front of your computer for a 4-hour block, because the vaccine appointments are gone, you know, in 4 hours. If you're at work and trying to get an appointment for your mom, you're out of luck, you know, for an entire month. And the vaccination sites are drive up only. And so persons with transportation problems are, you know, just can't get in there. So I was pleased to see that the Biden administration is really understands the importance not just of educating low-income communities, but making the vaccination programs in our state much more focused on those areas. You mentioned in California, they are doing that. That's not happening very much in Arizona, if actually at all.
Joe Williams, President Biden has talked about his economic relief package. He has proposed that $1.9 trillion package, as I mentioned. Of course, Congress still has to vote on that plan. What is the status of that right now? Because there are so many people who are out of work, businesses have closed, etc., who need this money.
That is exactly right, and that is part of the problem what the incoming administration is running into. You thought that Mitch McConnell and the Republicans did a fairly good job of blocking President Obama. Well, the word out of Capitol Hill is you ain't seen nothing yet. So far, President Biden is struggling even to get his cabinet appointees seated because Mitch McConnell wants a guarantee from the Democrats that they will not use the filibuster. Now, that's kind of strange in that he's using a filibuster to demand Democrats keep the filibuster, and in order to make that demand, in order to ensure that demand, he is holding up appointments to cabinet level appointees. He's holding up committee chairmanships for the majority Democrats, and he's still stymied in trying to work out a power sharing agreement with Chuck Schumer. So with all of that as the foredrop, the backdrop is this aid needs to happen, and it needs to happen quickly, and President Biden cannot do it on his own. He can't do it with an executive order because it involves spending federal money. So already we've run into some rocky shores, some rocky seas, rather, with regard to Republican cooperation. Even though everybody understands that this is quite important, there are people hanging on by a thread, trying to make sure that they can hold on long enough until the pandemic gets under control, but everyone knows that the economy won't bounce back until the pandemic gets under control, so they kind of have to operate hand in glove here. But it is very disturbing to see that the Republicans are not acting with as much urgency as the Democrats say they should, and as much as the country apparently needs, given the fact that we've had all these statistics, all these reports of businesses going under, and a lot of people really, really hurting for this money.
Kate, we're also getting reports, of course, these reports have been around for some time now, that there are multiple variants of this virus in different parts of the world. Another thing which is of deep concern to people is that there have been some reports from some doctors saying that the vaccines, the current vaccines that we have right now, in certain instances may be resistant to these new viruses. What do you know about that? Can you clarify that for us?
So this is something that's currently under investigation because they have to see what exactly the mutations are affecting in the spike protein and how that would affect the virus and the antibodies. And I think that, one area of concern is more people are now infected with COVID at a single time as have been infected in a single time in the past. And you basically get mutations as the virus replicates in people. And so that's why we're seeing a lot of the mutations now and not in the past, because there's more opportunity for these mutations to appear. So the CDC and other national laboratories will continue to study the new variants and to see whether or not the vaccine is still effective. It is a cause for concern, and it's a reason to try to roll out the vaccine faster so that we can really cut transmission, because if these more resistant types get more widespread, it really will be a problem in the future.
Gary, when we talk about the surge having reached its peak in a state like California, what does it actually mean, and what does it mean for the numbers coming down, the flattening of the curve?
Well, we are at that point. We still could go higher. It appears that we're slightly going down, but just today when I looked across 25 different hospital ICUs, they were all at 100% in Los Angeles, San Diego, the Inland Empire, San Bernardino, and Riverside counties. So we are not out of the woods yet. And one of the concerns is if we, as many of the speakers have said, if we convert current testing sites to vaccine sites and reduce testing, we're going to interfere with contact tracing. We're going to have a false sense that the number of positives have gone down, when in fact all we've done is shift away from testing. This has not been discussed. I really think the president is really on it when he said we need to have a strong testing system that goes along with a strong vaccination system.
Well, Humble, very quickly, the president has now talked about a mask mandate. It's, of course, mandatory in federal buildings, etc. But will that have any impact, say, on people in a place like Arizona, where you told us a number of places are still open?
Yeah, no, it depends. I think it depends in part in what Congress does with this new relief package. What I hope that they do is to tie relief funding to making sure that governors implement statewide face covering mandates that are enforceable. That would force a governor like ours that's hostile towards masks to say, okay, I want the money bad enough that I'll put in a face covering mandate.
Okay, and that's where we have to leave it. Thanks to all of you for being with us. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.